Hey guys, and welcome back to my channel. This is Dr. Tank, and in this video, we're going to talk all about strokes. Strokes are the fifth most common cause of death in the United States. Before we get into the treatment plan and what you might expect in the ER, let's talk about what a stroke is. So when we talk about strokes, there are two major types. One is ischemic, which is actually the most common cause. Around 87% of all strokes are ischemic. And number two is hemorrhagic. When we say ischemic stroke, we're referring to a blood clot blocking blood flow to a certain part of the brain. And when we say hemorrhagic, we're referring to a ruptured blood vessel. So how common are strokes? Around 800,000 people have strokes every year in the United States. Next, we're going to get into some of the symptoms of what a stroke can look like. But before we get into the symptoms, I want to stress one thing, and that is that time is the most important thing when you're talking about strokes. When you're losing blood flow to the brain, each second matters. And the longer you wait to get treatment, the worse the outcome may be. So let's talk about the most common symptoms you might see when you have a stroke. You can remember this by the FAST acronym. F stands for facial drooping, A is for arm weakness, S is for speech difficulty, and T stands for time to call 911. So again, that's FAST or FAST. We typically divide strokes into anterior strokes and posterior strokes. Each have their own unique symptoms. So the symptoms of an anterior stroke would be unilateral numbness or weakness. This can occur in the face, arm, or the leg. One way to check for this at home would be to hold your arms out in front of you, and you should not be drifting down. We typically want you to keep it there for at least 10 seconds, and then you want to be able to lift your leg up one by one and typically hold it in the air for 5 seconds. You can also check your sensation by touching your arm with something sharp and then something dull and making sure that it feels the same. You can check it on your face too and on your legs. Other symptoms of anterior strokes can be difficulty with your vision. You could have a severe headache. You can have some dizziness and difficulty walking. Posterior strokes are a little bit trickier. This can sometimes present with change in your gait. So for example, when you walk, you might be leaning towards one side. Your coordination might be off. You might not be able to reach for things that you could typically grab. Again, it can also affect your speech as well. And then you can also have non-specific symptoms such as nausea and vomiting, and sometimes a feeling of dizziness that will be present no matter what you do. And there's a few things that can look like a stroke but actually are not a stroke. You can have a really complex migraine that will actually be improved with typical migraine medication. After you have a seizure, sometimes you might present with stroke symptoms, but these will actually go away with time. If you have low blood sugar, you might also look like you're having a stroke, but once you correct the sugar, your symptoms will go away. So these are what we call stroke mimics that will also be checked out when you go to the hospital. Now, say you show up to ER with some stroke symptoms, what might you expect? Well, like we talked about earlier, they're gonna check your blood sugar, and depending on when you show up, a few things might happen. So there's a magic window that we say, which is the stroke window to receive treatment. This is 4.5 hours. Now, the sooner you come to the hospital, the better, but the maximum time frame you have to receive this medication would be 4.5 hours. And this medication is called TPA or TNK, depending on where you work. So again, you show up to the ER with some stroke symptoms. They'll check your blood sugar. They'll likely do a quick exam, maybe check your vital signs, and then likely you're going to end up getting a CT scan of your head. Now, the purpose of the CT scan is to rule out a brain bleed, because if you have a brain bleed, you'll likely need surgical intervention, versus if you don't have a bleed, you might be a candidate for this medication. Usually the doctor will run through a checklist with you and make sure that you are a candidate. And if you show up within the time frame, you might be eligible to receive this medication. I won't get into the risk and the benefits of this drug because there are quite a bit, and it's very controversial, as some people think it doesn't really do anything. But right now, it's really all we have. Now, there is a second treatment that you might get, which is called thrombectomy. Now, thrombectomy is actually a type of intervention where they will go into your brain, and if the blood clot is in an area where a specialist can pull it out, they can actually take it out. In order to be a candidate for thrombectomy, you'll likely need to get a CT angiogram because only certain clots in certain parts of the brain are retrievable. So if you are a candidate for thrombectomy, you'll likely be sent to the cath lab, or you'll be transferred to another facility that has the specialist that can perform it. The time frame that you're eligible to receive a thrombectomy would be 24 hours. Now, let's say it's been more than 24 hours since your stroke symptoms have begun and they aren't going away. Now, what can be done for this? Well, there are a few things. One, we can rule out those stroke mimics. Number two, we can also start you on antiplatelet medications. You can be admitted for further stroke workup, or they can arrange to get this done for you as an outpatient, depending on where you are. Now, after you have a stroke, there will be some other efforts down the road to try to get you back to your functional status. This will usually involve occupational therapy, physical therapy, and speech therapy. Now, I know that was a lot of information, but I want to leave you with this. What are a few things you can do to help prevent a stroke in the future? One is you can live a healthy lifestyle that includes a balanced diet, plenty of exercise. You should manage your chronic conditions. That may include controlling your blood pressure, controlling your diabetes. You should avoid smoking. And really, if you do develop any of these stroke symptoms, the best thing you can do is remember the fast mnemonic and report to your nearest emergency room for further management. Thanks so much for watching this video, guys. Hopefully you learned something, and I'll see you in the next one. Take care.